Morphology of reversible cell injury, also called as retrogressive changes. Retrogressive changes are the type of cell injuries seen mainly in the cytoplasm while the nucleus remains morphologically unaltered. These changes are reversible in various degrees when the injurious agent is removed. If these alterations progress, then the cell eventually dies. The causes of cell injury includes hypoxia, physical agents, chemical agents, biological agents, immune mechanisms, malnutrition, and genetic defects. Retrogressive changes. There are 4 retrogressive changes. Among them, first one is cloudy swelling or hydropic change. This is the commonest and the first manifestation of almost all forms of injuries to cells. It is fully reversible and is characterized by accumulation of water in the cells. Causes are bacterial toxins, chemicals, poisons, burns, impaired regulation of sodium pump. It is best observed in the renal tubular epithelium. The affected kidneys are enlarged and pale and are described as large white kidney. Histologically, the affected cells are swollen with cytoplasmic granularity. Microvasculature of the tissue is compressed by swollen cells. Water collection leads to hydropic change. This is characterized by the presence of cytoplasmic vacuoles. But the nucleus is not affected as you seen in light microscopy. Pigments, casts, and hyaline casts may be seen. Other organs which show cloudy change or hydropic change are isolate cells of Langerhans. Cloudy swelling due to failure of the cellular sodium pumps. This will allow the excess sodium to enter the cells and there will be eventually increase in cellular water. Hydropic degeneration is very common and the cloudy swelling occurs with hypokalemia due to vomiting or diarrhea. Hydropic degeneration is a severe form of cloudy swelling. After the cloudy change, the second change, retrogressive change, is fatty change. It is seen in parenchymatous cells of the liver, heart, and kidney. Lipid droplets will accumulate in the cytoplasm and in extreme cases they will push the nucleus to the periphery, giving the cell a signet-ring appearance. This fat can be demonstrated by using fat stains like Sudan 3, Sudan 4, oil red O on frozen sections of the tissue. Grossly, organ is enlarged and it is yellowish on cut section, greasy. Mucoid change. When there is excessive amount of mucus in the unusual locations, it is called as mucus degeneration. This affects both the epithelial cells as well as the connective tissue. Then it is called as myxomatous change. Cancers with high degree of mucinous degeneration are called mucinous carcinomas or colloid carcinomas. Excessive cytoplasmic mucin distends the cells, pushing the nucleus to the periphery. The mucin is structureless and basophilic in H and E sections, which you can observe in the picture. There are 2 types of mucin. One is true mucin and the other is paramucin. Hyaline change. Hyaline is a translucent, homogeneous, structureless material that will stain pink with the H and E. Both epithelial and connective tissues are affected. Epithelial hyaline is seen in renal tubular cells, liver cells, prostate, corpora, amalacia. Connective tissue hyalinization is seen in old scars, subintimal connective tissue of small blood vessels, arteriosclerosis, and in tumors like leiomyomas. Jenker's degeneration, which was first discovered by Jenker in fatal cases of typhoid, which affects the voluntary muscles of abdomen. Diaphragm, characterized by loss of striations and hyalinization of fibers.